certified medical assistants basically are running offices. So we do all of the administrative as well as all of the clinical work within a physician facility. We are going to be doing rooming, we're going to be scheduling, insurance verifications, billing, vitals, EKGs, injections, medications. The list is really endless on what you do in your day. Honestly, it's the interaction with patients. You really become familiar with patients, so it makes your day a little bit smoother knowing people who come in on a pretty steady basis, so you're not just seeing new faces 100% of the time. Get into it because you love it, not because you love the money. Especially people who start in medical assisting, they get into it because you love healthcare. People who aren't sure necessarily what aspect of healthcare they want to get into can actually choose medical assisting because you can bridge it if you want to further your education later on. It sort of gets you a good overall picture of everything that you could potentially handle within healthcare compared to some of the other healthcare professions, which are more singular in what you're going to be doing every day. Students will start in September and then they finish at the end of summer 1. So it is less than a year. They will sit for the Certified Medical Exam or CMA exam through the American Association of Medical Assistants. If they find it too hard, they can sit for the Registered Medical Assistant exam or RMA exam, which is hosted by a different company, American Medical Technologists. Depending on facility, it is around $30,000 to $40,000 per year. If you're within a facility that has tiered promotions, which some do for medical assistants, you'll get a pay increase as you promote up. You do have to prove you're CPR certified already. You will have to take a TEAS. However, we do have a bypass for the TEAS. If you have previously taken College English 101 and then College Psychology 101, it will allow you admittance into the program without having to take the TEAS. It's a pretty short, accelerated program. You're going to be finishing within a year, roughly. You're going to be learning all of the foundational skills you need to do for admin and clinical work within an ambulatory care setting. Anybody who's not 100% sure if they're cut out for healthcare or not quite sure where they want to be, this is a good foundation starting block.